Got halitosis worse than a caveman's? What are the best natural remedies for bad breath? Are you suffering from bad breath that's worse than a caveman's? Don't worry, you're not alone. Halitosis, or chronic bad breath, affects millions of people worldwide. It can be embarrassing and significantly impact your self-confidence. But don't fret, because there are natural remedies for bad breath that can help freshen up your mouth and keep it healthy. In this blog post, we'll discuss what causes halitosis, who is susceptible to it, how to prevent it in the first place, and the best natural remedies for beating bad breath once and for all. So let's dive right into it. What is halitosis? Halitosis, commonly known as bad breath, is a condition characterized by unpleasant odors emanating from the mouth. It can be caused by poor oral hygiene, certain foods and drinks, or other underlying medical conditions. One of the most common causes of halitosis is bacteria that accumulate on the teeth, gums and tongue. When these bacteria break down food particles in your mouth, they release foul-smelling gases such as sulfur compounds that contribute to bad breath. Other factors that may contribute to halitosis include smoking, dry mouth, xerostomia, gum disease, periodontitis, and certain medications. In rare cases, it can also be a sign of an underlying medical condition such as liver failure or diabetes. Regardless of what's causing your bad breath, it's important to take steps to address it. Not only does persistent bad breath affect your social interactions, but it can also indicate more serious health problems if left untreated. By understanding what causes halitosis and how to prevent it with natural remedies we'll discuss later in this post, you can keep your mouth fresh without resorting to harsh chemicals or expensive treatments. What causes halitosis? Halitosis, or bad breath, can be caused by a variety of factors. One common cause is poor oral hygiene, which allows bacteria to build up in the mouth and produce foul-smelling compounds. Other culprits include certain foods like garlic and onions, as well as tobacco use. Medical conditions such as gum disease and dry mouth, xerostomia, can also contribute to halitosis. Infections in the respiratory tract or sinuses may lead to bad breath too. In some cases, underlying health issues like diabetes or liver disease can cause chronic halitosis. Even stress and anxiety can sometimes result in bad breath due to changes in saliva production. It's important to note that while strong odorous foods are often blamed for causing bad breath, they usually only have temporary effects on your overall oral odor. So if you're dealing with persistent halitosis, it may be worth exploring other possible causes and solutions with your dentist or doctor. Who is susceptible to halitosis? Halitosis, or bad breath, is a common problem that affects many people. It can have different causes and factors that contribute to its development. One of these factors is susceptibility. Everyone is susceptible to halitosis regardless of age, gender, or background. However, there are certain groups of people who are more prone to develop bad breath than others. One group includes those who suffer from dry mouth due to a lack of saliva production in their mouths. Saliva helps wash away bacteria and food particles that could cause odors inside the mouth. Another group includes individuals with poor dental hygiene habits such as irregular brushing or flossing, or not visiting the dentist regularly for checkups and cleanings. Moreover, smokers are also at higher risk for developing halitosis because tobacco products leave an unpleasant odor in the mouth and throat areas. Additionally, people with medical conditions such as sinusitis or gastrointestinal problems may experience bad breath due to the presence of bacteria in those regions. Anyone can develop halitosis, but some individuals may be more susceptible than others depending on their lifestyle choices and medical conditions. How to prevent bad breath? Preventing bad breath is much easier than treating it. The best way to prevent bad breath is by practicing good oral hygiene. Brushing your teeth at least twice a day with fluoride toothpaste and flossing daily will help remove food particles and bacteria that cause bad breath. Another way to prevent bad breath is by cleaning your tongue regularly. Bacteria can build up on the tongue, causing an unpleasant odor. Use a tongue scraper or brush to gently clean your tongue once a day. Drinking plenty of water throughout the day helps keep your mouth moist and washes away food particles and bacteria that can cause bad breath. Avoid sugary drinks like soda, which can lead to tooth decay and contribute to halitosis. Eating a healthy diet rich in fruits, vegetables, and whole grains can also help prevent bad breath. Foods that are high in protein such as meat or dairy products tend to leave behind residue on the teeth which causes odors. Avoid tobacco products like cigarettes or chewing tobacco which not only stain the teeth but also dry out the mouth, leading to halitosis. By following these steps, you can easily prevent bad breath from occurring in the first place. What causes bad breath? Bad breath, also known as halitosis, can be caused by a variety of factors. One of the most common causes is poor oral hygiene. When food particles are left in the mouth for too long, they begin to break down and produce an unpleasant odor. Another cause of bad breath is dry mouth or xerostomia. Saliva helps to wash away bacteria that can cause bad breath, so when your mouth is dry, odorous compounds can build up. Certain foods and drinks such as onions and garlic can also contribute to bad breath. These foods contain sulfur-containing compounds which are absorbed into the bloodstream and released through the lungs. Smoking and tobacco use not only stain teeth but also contribute to bad breath due to the buildup of harmful chemicals in the mouth. In some cases, underlying medical conditions such as sinus infections or gastrointestinal issues can lead to halitosis. In these cases, it's important to consult with a healthcare professional for proper diagnosis and treatment. Maintaining good oral hygiene habits such as brushing twice daily with fluoride toothpaste and flossing regularly can go a long way in preventing bad breath. Best natural remedies for bad breath. There are several natural remedies that can help combat bad breath, also known as halitosis. One of the most effective remedies is drinking plenty of water throughout the day. Staying hydrated helps to flush out bacteria and food particles from your mouth. Another remedy is chewing on herbs such as parsley or mint leaves. These herbs contain chlorophyll which neutralizes odor-causing compounds in the mouth. Using baking soda as a toothpaste or mouthwash can also help eliminate bad breath. Baking soda has antibacterial properties and can balance the pH levels in your mouth. Oil pulling with coconut oil is another great natural remedy for bad breath. Swishing coconut oil around in your mouth for 10 to 15 minutes daily can help remove toxins and bacteria that cause unpleasant odors. Incorporating probiotics into your diet can promote good oral health and reduce bad breath. Probiotics promote healthy gut flora, which helps to prevent bacterial overgrowth in the mouth. By incorporating these natural remedies into your daily routine, you can effectively combat halitosis and enjoy fresh breath all day long. How to prevent halitosis. Halitosis, more commonly known as bad breath, can be quite an embarrassing condition to deal with. Luckily, there are simple steps you can take to prevent it from occurring in the first place. Firstly, maintaining good oral hygiene is key. This means brushing your teeth twice a day and flossing at least once a day. Additionally, using mouthwash can help kill any bacteria that may be lingering in your mouth. It's important to also clean your tongue regularly as it can harbor odor-causing bacteria. You can use a tongue scraper or even just brush your tongue gently with your toothbrush. Another factor contributing to halitosis is dry mouth. Drinking plenty of water throughout the day helps keep your mouth hydrated and produces saliva which helps wash away food particles and bacteria. Avoiding certain foods such as garlic and onions which contain strong odors that linger in the mouth can also help prevent bad breath from occurring. By following these simple tips for preventing halitosis, you'll not only have fresher breath but also maintain better overall oral health. Conclusion. Fortunately, there are also plenty of natural remedies available that can help combat halitosis. From consuming foods with antibacterial properties like parsley and ginger, to practicing proper oral hygiene habits like brushing your teeth twice daily and flossing regularly, there are several simple steps you can take towards fresher breath. It's important to note that while these natural remedies may offer temporary relief from bad breath symptoms, they do not address any underlying dental or medical issues. If you experience chronic halitosis despite trying these remedies or notice any other concerning symptoms such as bleeding gums or tooth pain, it's crucial to seek professional dental care. Preventing and treating bad breath often involves taking a multifaceted approach, incorporating healthy lifestyle habits alongside targeted treatments specific to the root cause of your halitosis. By staying proactive about your oral health and seeking out appropriate treatment when needed, you can keep your smile fresh and vibrant for years to come. Halitosis can be an embarrassing and frustrating condition to deal with. However, with the right knowledge and tools, it is possible to prevent and treat bad breath naturally. By incorporating good oral hygiene habits into your daily routine, as well as implementing natural remedies such as drinking water regularly or using essential oils for mouthwash, you can keep your breath fresh and clean. It's important to remember that bad breath isn't always caused by poor dental hygiene. Underlying medical conditions may also play a role in its development. If natural remedies don't seem to make a significant impact on your halitosis symptoms, it might be time to seek professional help from a dentist or doctor. By taking action early on, you can stop bad breath in its tracks before it starts affecting your confidence and social interactions. So why wait? Start incorporating these tips into your daily routine today and enjoy fresher breath tomorrow. As we come to the end of this blog post on natural remedies for bad breath, it's important to remember that halitosis is a common issue that affects people of all ages and backgrounds. From poor oral hygiene to underlying medical conditions, there are many factors that can contribute to bad breath.